Good morning, everyone, and happy Valentine's Day to everyone. So, everybody, make sure that you're good to your sweethearts today. So, this morning, I'm sorry, I
It's
said this morning,
afternoon.
it's afternoon. This afternoon, I'm joined by Michelle Eberly,
Mhm.
okay,
Correct.
of the Maryland Health Benefit Exchange. Michelle is currently working with Senator Hester of Howard County on Senate Bill 977. Good
That's
morning,
correct.
good afternoon, Michelle. I am way behind.
Good afternoon and happy Valentine's Day to
Well,
you.
thank you. Thank you. Well, can you tell us a little bit about Senator Hester's bill, as well as you said there's another bill that just dropped?
Absolutely. We're really appreciative of Senator Hester because she has just in the forefront of her mind really wanting to help small businesses. And that's one of the goals of the exchange as well that we put on as our strategic initiative this year. So I'll just give you a little bit of information. We have found in the course of going around talking to small businesses and talking to individuals in Maryland that small businesses, particularly those with 25 and fewer employees,
Mm-hmm.
feel they've been left out of the insurance marketplace. That there's been a lot of focus on individuals, there's been a lot of focus on large businesses, but the small ones have really felt left out. So, through the exchange and through talking to our chambers of commerces and different associations, we've worked over the summer, the exchange, and worked with Senator Hester, Delegate Motz, to come up with some ways that we could really help the small business community.
Mm-hmm.
The bill that Senator Hester is sponsoring, which is Senate Bill 977,
Mm-hmm.
and there's a companion bill in the House that Delegate Robin Lewis is sponsoring, House Bill 0930. Both those bills would establish a subsidy program for the small businesses, give the exchange the authority to operate that subsidy program,
Mm-hmm.
and provide funding for the program. So that's a critical component. It's $15 million worth of funds.
Oh, wow.
So I'll tell you about the companion bill, and then I'll give you kind of the bigger picture again, or the related bill.
Okay.
Delegate Motz has filed a bill, House Bill 1329, that also would create the subsidy program. So we're kind of taking it from two sides. His bill would allow any funds that remain in the exchange fund at the end of the year to stay with the exchange and get rolled over into a small business subsidy fund.
Mm.
So, what we have found is that through the Affordable Care Act, the way that the tax credit works today for small businesses is that they have to, if they provide insurance for their employees, they have to make those payments up front. And at the end of the tax year, they can file with the federal government and try and get collect a tax credit for
Right.
what they have paid out. The problem is, especially with those small employers, 15 and under, they don't have the liquidity that a larger business would have.
This is
So
true.
oftentimes they don't have those funds to expend every month.
Mm-hmm.
What we have done is we're going back to the federal government and saying, give us the money that you would have paid out to those small businesses. We want to add to that money the $15 million from Senator Hester's bill
Okay.
and whatever funds may be in the exchange fund at the end of the year, and create a small business subsidy program where we could provide employers every month a subsidy to help them with providing insurance to their
Well,
employees.
so let me ask you on that. On the
Mhm.
small business owner, so would I have to send in a request monthly for that, or would that be an automatic payment to the small business? How is that going to be?
The details have not been worked out yet to
Okay.
that degree, but I will tell you that we want to make it as simple and as easy for small
Sure.
businesses. The exchange has also put in a lot of effort this year to create a Maryland Health Connection for small business.
Mm-hmm.
So our intent is that a small business owner, many insurance is complicated. They don't
Mm-hmm.
understand insurance. They don't have time. A lot of small businesses are active participants in their business.
Mm-hmm.
So they may not have an HR department. They don't have time to do everything around getting health insurance. So we want to make it easy,
Sure.
simple, and that's the intent of the whole process we're going for.
So with this, so again, It's in the details, of course. We're right now trying to get the bill through. So you have the number of $15 million, and that's the fiscal note on the bill. Is that it? What are we looking at?
That is the funding for it, and I believe there's also an additional 2 million in that bill that would pay for the exchange operations of
Mhm.
it and marketing and outreach and
Okay.
things such as that.
Okay, so you get, okay, it goes through, which I hope it will, and then you go begin the process. What happens if you get more applications than you have funding for the 15 million? Okay.
Mhm. There used to be a small business subsidy program in the state of Maryland before
Okay.
the Affordable Care was implemented. And how that operated is that it was open until the funds were exhausted, and then it was capped
Okay.
that year. So, again, those are the details we'd have to work out.
Sure.
Some of this is what we're thinking and what others have weighed in on. We actually have a small business advisory group.
Okay.
And so part of that in discussions with them is saying, well, let's make this available to small businesses that don't already offer insurance.
Mm-hmm.
So people that can afford it and have been able to do it, this isn't really intended for those.
Mm-hmm.
This is intended for those that this is outside of their reach, and we really want to help them provide
Gotcha.
insurance.
Well, this is really now it's my understanding that like 27% of small businesses with less than 10 employees do not offer employee sponsored programs, and so
Mhm.
this is a real need that is out there.
It's a big need.
It is a big need. And so as members with our membership that has, that all small businesses and whoever represents small business, this is a great benefit for them. So now I understand, now we all have hearings. All
Mhm.
these bills have hearing. Now I understand the Senate bill hearing is, I think, on February 20th.
That's correct.
Okay, so our membership who are interested in there, listening in, if they want to reach out to their representatives, should they do this before the hearing date? And what do you think they should be doing right now?
That would be most helpful. So they can reach out to their own representative and send an email, call the office. If they're actually available to come for the hearing, I always
Mm-hmm.
encourage people to come sit in the hearing just for one, that you're feeling part of the uh, policy making and lawmaking process in the
Mm-hmm.
state. So that's interesting. And also that their voice is heard. Everybody's voice is heard. So they can sign up to testify. It's always very helpful for legislators to hear from people that would be affected
Hear
by
their
bills.
stories.
Hear
Hear
their
their stories.
stories.
Oh, yeah.
So to be able to sit there and say, this would really help me be able to provide insurance.
Mm-hmm.
That's always important. So anyway, email, phone call, come in person.
Yeah. Now, the other thing is, okay, everything goes through, everything's great. When will what is the effective date on these bills?
The bills, because I think that the challenge is going to be around the funding.
Okay.
So I don't doubt that the subsidy program will be established.
Mm-hmm.
And I'm not sure how the bill is written, if it gave a date of 1/1 or immediately.
Mm-hmm.
But as soon as as soon as we get the authority, we're already moving in that direction.
Moving forward.
So we'll get it implemented as soon as possible. There's still details to be worked out,
Mm-hmm.
but again, and if any of your listeners are interested in participating on our small business advisory group, please have them reach out to me, because we want people that will be affected to be at the table helping us
Right.
design things, because that's who can make the program the best.
Well, Michelle, why don't you go ahead and give them your email address
Absolutely.
so that you can have that.
It's Michelle, Michele .Eberle, EBERLE at maryland.gov.
Wonderful, wonderful. Well, I thank you so much for sharing your information about the benefits and what type of hurdles I know that we're all affected by with insurances. And so hopefully this will help many small business owners in the state of Maryland, which is wonderful. Now, at this point, I want to recognize Michelle for her work in the healthcare arena. Because of her work, the Maryland Daily Record has awarded Michelle one of the 2020 influential. Oh my gosh, isn't that awful? Say it for me, Michelle.
Influencers.
See,
Influencers.
Okay, Marylanders for her work in healthcare. So that is amazing, Michelle. Look at you. That's great.
It is very exciting, and what's exciting is that I get to work every day with people like yourself
Oh,
who
thank
are
you.
helping us really make a change in Maryland to get more people health care and keep people healthy, and that's really great.
Well, the work that you're doing is definitely being recognized, and I'm telling you, you're doing an amazing job.
Thank you.
And thank you so much for doing it, and thank you for being our voice down in Annapolis on these very important issues.
My pleasure.
Thank you. So next week, I'm going to be joined by Jim Marney, who's actually going to be giving us an update on the whole session. And just to give you a little update, we currently have now. I don't know, Michelle, you might have some newer numbers for us, but as of yesterday, we had 1,060 bills in the Senate side and 1,642 House bills. So we're knocking on the door of 3,000. So
It's a lot of bills.
a lot of bills, a lot of bills. And thinking about this, we only have 52 days left in the session. So that's going to be a lot of things to be happening. So you have to ask yourself, how many of these bills are going to make it through? So this is why the work that Michelle is doing is so important, and also what Jim Marney and the representatives of the society are doing down in Annapolis, because not every bill can be heard. And so, we really have to be down there again, sharing our stories and being a part of that whole process, because they need to hear from all of us. So I just wanted to share that. On a couple other notes about the society, Monday's Lunch and Learn program has been postponed until Monday, April 20th. So we only had a couple people register. So again, I guess you guys are doing taxes. You would have thunk it, right? So we're going to postpone that until April 20th. Also, just a little reminder that the IRS is going to be closed on Monday because of President's Day. So just be aware of that you're not going to be able to do much electronic filing or making those phone calls to the IRS on Monday. Just also a side note that the day after President's Day is the busiest phone day with the IRS. So if you really need to talk, I would not call them on Tuesday, because they are going to be jam packed with phone calls. So just be aware of that. Now, again, I'll see you next Thursday. I want to wish everyone a wonderful day. And again, happy Valentine's Day to everyone. And again, Michelle, happy Valentine's Day. And again, thank you for joining me.
My pleasure.